A patient reached out to me recently, and in his test results, it indicates that one of his testes is undescended, like it's not in the scrotal sac. Even though his semen analysis indicates that he has some sperm cells and the motility, the morphology, they are fair, even though they need to be well optimized. So now he's asking that should he embark on surgical procedure to bring back the testes within the scrotal sac. So the advice I have for him and for others passing through the same condition is that surgical procedure within the testicular environment is very complicated because of the fragility of the testis and its surrounding tissues. Since the testis, I mean the one testis that is in the scrotal sac is still able to produce sperm cell, the motility, the morphology is still fair, I strongly advise that you work on improving the testicular function, because if you bring back, try to bring back the testis to the scrotal sac, there are two ways to it. It's either you get the positive result whereby everything goes well, the result is certain and everything is impressive, or the other way around whereby it leads to complication that affects the that's one testis that is still functioning. Like there are cases whereby people do surgery to address one condition within the testis, and at the end of the day both testes get damaged, like both of them are damaged beyond repair. So it won't be ideal that you put yourself at this risk, because if the complications happen, it might be irreversible. So I strongly advise that you work on improving the testicular function of the one testis that is functioning, and the goal is to get pregnant, get your lady pregnant, and have a child or have children of your own. Then he also asks a question that, have it always been like that before, or was the testis within the scrotal sac, then it later ran up? So the short answer to this is that is the way you were born. Because during the fertile life of a male child, the testis goes below the kidney, like it goes below the kidney, and as the child is developing during the fertile life, the testis descends gradually to the scrotal sac, to the location that it is right now. So for some individuals, or more commonly for those that are born prematurely, their testes or some of their testes can stay above the scrotal sac. Some can be within the pelvic region, some can even be above in the abdominal region. So if it happens like that and it's not able to correct itself within the first 3 months of after you are giving birth to, then sometimes it may require surgical procedure early in life, like within the first few months. Then that can still be well corrected with very low chance of complications. But for someone who is over 30 years who is having undescended testes, so bringing back the testes to the scrotal sac, yes, that is the anatomical position for the testes, but the testicular function might not be rejuvenated in most cases. So since you have one that is functioning, so manage that one and you can get the results with that one testis that is functioning optimally. So thanks so much, Nika.